You could be missing crucial signs that could change how you care for a loved one in their final months. Every day, families unknowingly overlook subtle clues that their elderly loved one's health is deteriorating. We often chalk these changes up to aging, but these signs are far more than just a natural progression. They are critical indicators that can help you provide better care, create lasting memories, and ensure a peaceful, dignified end to your journey. Many people don't realize that these signs can appear months or even years before the final stages of life. By recognizing them early, you can make a profound difference in how your loved one experiences the final chapter. Here are 5 key signs to watch for, and why understanding them matters. If you are not subscribed, subscribe and activate the notification bell so you don't miss any videos. 1. Significant weight loss. Significant weight loss in elderly individuals is often one of the first noticeable signs of health decline. Initially, the symptoms may seem subtle: looser clothes, a belt needing to be tightened, or a decrease in appetite. Many families tend to dismiss these changes as a normal part of aging. However, unintentional and rapid weight loss is a serious concern and should not be overlooked. When an older adult starts losing weight without actively trying, it indicates the body is struggling to absorb nutrients effectively, leading to a potential deterioration of muscle mass. This loss of muscle, or muscle wasting, can cause significant problems, including a weakened immune system, a higher risk of falls, and a greater susceptibility to infections. Additionally, the body's internal systems begin to slow down, which contributes to this decline in health. A reduced appetite is another common reason behind weight loss in the elderly. Many older adults experience a decreased sense of taste and smell, making food less enjoyable and, consequently, leading to a reduced desire to eat. This isn't just a matter of preference. It's a natural physiological change as the body prepares for the later stages of life. Without the usual hunger signals, individuals may struggle to maintain a healthy weight. This gradual decline in strength and health can be linked to other factors like chronic medical conditions, including heart failure, cancer, and kidney disease. Mental health issues, such as depression or cognitive decline, can also cause reduced eating habits, further contributing to weight loss. Although families may attempt to offer favorite foods or supplement meals with protein drinks, significant weight loss despite these efforts signals a deeper issue within the body. Rather than focusing solely on food intake, it's crucial to prioritize hydration and offer comfort foods that are easy to eat. Significant weight loss is a warning signal from the body, indicating a need for deeper care and attention to maintain the individual's well-being during this stage. 2. Extreme fatigue and weakness. Extreme fatigue and weakness are often clear indicators that an elderly person may be nearing the end of their life. Unlike the regular tiredness people experience after a long day, this exhaustion is profound and persistent, rarely relieved by rest. Everyday tasks, such as getting out of bed, walking, or even engaging in conversation, can become overwhelming. The vibrant individual who once participated in activities with ease may now find even the simplest actions to be exhausting and difficult. This deep fatigue is not just a normal part of aging. It signals that the body is slowing down and conserving energy. As organs begin to decline in function, the body prioritizes its most essential systems. The heart may struggle to pump efficiently, circulation weakens, and muscles do not receive enough oxygen to maintain physical activity. Many elderly individuals in their final months may experience longer periods of sleep, as their energy shifts away from movement and towards preserving essential bodily functions. In addition to the physical exhaustion, there's often an emotional toll associated with this fatigue. Seniors who were once independent and proud of their ability to care for themselves may feel frustrated or embarrassed by their inability to perform simple tasks. This emotional struggle can lead to social withdrawal, as they might avoid interactions or hobbies they once enjoyed. This isolation can create a cycle that accelerates their physical decline, as lack of social engagement can negatively impact overall health. For families, watching this transformation can be heartbreaking. It's natural to want to encourage the person to engage more, but pushing them to do so can be harmful. The most important thing to offer at this stage is rest. Acknowledging their limits and providing comfort and understanding is key. Instead of focusing on physical activity, offer emotional presence, allowing them to rest peacefully. Their remaining time is valuable, and providing support in this way is one of the most meaningful ways to care for them. 3. Cognitive confusion and emotional withdrawal. As the body prepares for the end of life, the brain undergoes profound changes that manifest in cognitive confusion and emotional withdrawal. People who were once mentally sharp, alert, and engaged may begin to show signs of forgetfulness or struggle with tasks they previously performed effortlessly. Simple activities, such as following a conversation, recalling important details, or even recognizing familiar faces, may become increasingly difficult. You might notice that the person begins to repeat themselves, forget names, or lose track of time. These behaviors, which were never present before, can be distressing both for the individual and for those around them. What is most challenging, though, is that these cognitive changes often occur gradually over months or even up to a year before death, signaling a decline in the brain's functionality. The brain's ability to perform essential tasks diminishes due to the reduced flow of oxygen and nutrients, as the body's circulatory system weakens. As this happens, confusion and disorientation become more prominent, and the individual may struggle to make decisions or even recognize people and places they have known for years. The cognitive decline that accompanies the end-of-life process often leads to emotional withdrawal as well. The individual may no longer feel the need to engage in social interactions, or they may become emotionally distant, withdrawing into their world. What was once a person who thrived on conversation, socializing, and maintaining relationships may now find these activities tiring, overwhelming, or even irrelevant. The person may become less interested in participating in activities that they once enjoyed, and familiar environments might feel unfamiliar or distressing. This emotional detachment is not due to a lack of love or care. Rather, it's a result of the brain's reduced ability to process emotions and connect with others in the way it did before. In many cases, elderly individuals nearing the end of life may retreat inwardly not because they have ceased to care about their loved ones, but because their cognitive and emotional processing abilities have diminished. Their ability to engage with the world around them becomes increasingly limited. For families and caregivers, witnessing these changes can be an incredibly painful experience. It often feels as though the person is slipping away before their physical death, and this emotional loss can be just as challenging as the inevitable passing. However, it is important to recognize that these cognitive and emotional shifts are not intentional or under the control of the individual. Instead of pushing the person to participate in conversation or activities, the most compassionate response is to meet them where they are in their experience. Speak gently and softly, offering reassurance when possible, and create a calm and comforting environment that helps ease their distress. Even if the person is no longer able to respond verbally or actively engage, they can still feel the love, care, and presence of those around them. Offering emotional support and companionship, even in silence, is often more meaningful than forcing interaction. It is in these quiet moments that your presence can bring the greatest comfort, allowing them to feel safe, cherished, and supported as they navigate this final phase of life. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. 4. Frequent infections and slow healing. As the body enters its final stages, one of the most noticeable and significant signs of decline is a weakened immune system. This results in the individual being more susceptible to infections and illnesses that they might have easily fought off in the past. If your loved one, who rarely seemed to fall ill, now catches every cold or infection that circulates, it's a clear signal that their immune defenses are no longer functioning as effectively. What once would have been a minor, short-lived illness now lingers for extended periods, and even small cuts or bruises take much longer to heal than they used to. These recurring infections are a direct result of the body's inability to defend itself as it once did, making it harder for the individual to recover from common ailments. As the immune system weakens, infections such as pneumonia, urinary tract infections, UTIs, and even skin infections become more frequent and harder to treat. The body's immune response becomes slower and less effective, which means that treatments that worked well in the past may no longer be as successful. Even with the use of antibiotics or other medical interventions, these infections may continue to recur or fail to resolve fully. This constant battle with infections can be physically exhausting and emotionally draining for both the individual and their family. Another consequence of a weakened immune system is slow healing, especially when it comes to chronic wounds such as pressure sores or minor cuts. Poor circulation, which naturally occurs as the body declines, restricts the flow of oxygen and nutrients to the skin and tissues. This makes it significantly harder for wounds to heal efficiently. The slow healing process can, unfortunately, lead to more severe infections if the wounds are not properly managed. If the body is unable to heal itself effectively, even small injuries can become life-threatening, making it essential to monitor and care for these wounds diligently. For families, dealing with frequent infections and slow healing can be emotionally and physically exhausting. The desire to help a loved one heal is natural, and it's tempting to seek out new treatments or push for another round of antibiotics in the hope of curing the problem. However, at a certain point in the end-of-life process, it's crucial to shift the focus away from curing and toward comforting. This might mean ensuring that the individual stays well hydrated, keeping their skin clean and moisturized, and reducing physical stress on their body to prevent further complications. Comfort, rather than trying to prolong life unnecessarily, becomes the top priority. The ultimate goal is to provide peace and dignity in their remaining time, allowing them to rest and be at ease without the additional burden of trying to heal from infections that their body can no longer fight effectively. 5. Major changes in breathing or circulation. As the body nears the final stages of life, major changes in breathing and circulation become increasingly noticeable. These changes often signal that the body is preparing for the end. One of the most noticeable signs is a shift in breathing patterns. Your loved one may begin to breathe more shallowly or irregularly. You might observe periods where their breath seems to pause between inhalations, or their breathing may fluctuate, speeding up and then slowing down unexpectedly. In some cases, you may notice a rhythmic pattern where deep breaths alternate with long pauses, known as Cheyne-Stokes respiration. This pattern can be unsettling, but it's a natural sign that the body is winding down. These changes indicate that the body is no longer able to maintain normal respiratory rhythms, reflecting the decline in its ability to sustain essential functions. Alongside changes in breathing, circulation also starts to shift. The body begins to prioritize blood flow to vital organs, reducing circulation to the extremities. This leads to noticeable changes in the hands, feet, nose, and ears, which may become cold to the touch. Additionally, the skin may appear pale, bluish, or mottled, especially around the fingers and toes. This is a result of the heart no longer pumping with the same strength as it once did. As circulation slows, the extremities are no longer receiving the same amount of oxygen-rich blood, causing these physical changes to occur. Shortness of breath, even with minimal exertion, is another critical indicator of decline. If your loved one struggles to breathe, even when sitting up or talking, it's a sign that their lung function is deteriorating. Fluid buildup in the lungs, a common occurrence in the final stages, can lead to persistent coughing, wheezing, and difficulty catching one's breath. This can be both physically taxing and emotionally distressing for both the individual and their family. For families, witnessing these physical changes can be deeply frightening and unsettling. The sight of shallow breathing, fluctuating patterns, and the visible decline in circulation can bring a sense of helplessness. However, it's crucial to understand that these changes are a natural part of the dying process and are not something that can be reversed or stopped. At this point, the focus should shift away from trying to fix the changes and toward providing comfort and relief. Keeping the room cool can help alleviate discomfort, and using a humidifier may ease any congestion or dryness in the airways. Offering small sips of water, if tolerated, can also provide some relief. In certain cases, medications or oxygen therapy may help ease breathing difficulties, allowing for a more peaceful and comfortable experience. The primary goal is to ensure that your loved one is as comfortable and at ease as possible, focusing on quality of life during these final stages. As we've explored today, The process of aging and the final stages of life bring about significant physical, emotional, and cognitive changes. From unintentional weight loss and extreme fatigue to cognitive confusion, frequent infections, and changes in breathing and circulation, each sign offers us a deeper understanding of what our loved ones may experience as they approach the end of their life. These are natural parts of the aging process, and recognizing them allows us to provide the care, compassion, and comfort that our loved ones truly need. So, what have you learned from this video? Is there one thing you've discovered that you will bring into practice as you care for those around you? We'd love to hear your thoughts. Please comment below and share one key takeaway you plan to apply in your own life. If you enjoyed this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more helpful content. Thank you for watching, and we'll see you in the next video.